That simply means that this hospital will not be able to survive without it, ladies and gentlemen. At this time, I need some help. Hakeem, please join me. Stand right beside me here. I'm sorry. Governor Hochul, please join me. Governor, you spoke about COVID. I'll tell you about COVID. At this institution, Dr. Scott, respectfully, I would like to call on Dr. Prasanna Alston to the podium. Ladies and gentlemen, for those who don't know her, cameras, this is Dr. Prasanna Alston. She is our Chief Nursing Officer for the system. She is also the Executive Director here, interim, at Interfaith Medical Center. 2020, when our shores was hit and our doors were hit with COVID, this lady came to work with a suitcase. Dr. Scott, you knew about it. She spent 4 months in this institution and she did not go home. She never went home. This lady, from 5 o'clock in the morning, she was on the units up until 10 p.m. at night, making sure that we were protected, making sure that we had the tools we needed, and making sure that the staff was supported. And you know what, ladies and gentlemen? She was never afraid. And if she was, she didn't show it. Today, I want to present to you our hero, our COVID hero, Dr. Prasanna Alston. That deserves a standing ovation, ladies and gentlemen. Thank you, Dr. Alston. Now, this is for you, Governor. We are 1199 members, 450,000 people strong. I'm so sorry, I need to see you. We are 450,000 people strong. We presently have a brand new president, Yvonne Armstrong, and an executive, Veronica Turner. You can call on us anytime. We'll get the buses ready and we will join you. We will fight because this is not an option. You cannot take away what is our right. And you know what? We will stand with you, Governor. Come on over here, Mr. Jeffries. I'm sorry, Governor. Come on over here. I want to talk to you. You're from Bed-Stuy, born and raised. You don't know what it's like to be afraid. You've never been afraid. You were here a few months ago on the same stage talking about Medicare cuts. You left with an assignment to fix it with your colleagues in Washington. Obviously, it has not been fixed. One more time, ladies and gentlemen, I am giving our Hakeem Jeffries another assignment. Go back to Washington. Tell them that we mean business. It's 450,000 of us, and we're going to get community involvement. This is no time to joke. This is no time to play. We need Medicare funds, and we need it now. You know what, media? This message is for you now. Healthcare is a human right. Healthcare is a human right. Thank you very much, ladies and gentlemen, and thank you for this. I present to you the one and only Mr. Hakeem Jeffries.
Thank you so much, Michelle, and good afternoon, everyone. Good afternoon. It's an honor and a privilege to be back home in the 8th Congressional District, to be here in Bedford-Stuyvesant, to be here at the Interfaith Medical Center with all of you and our governor. So thankful for her leadership, thankful for her presence, thankful for her strength on behalf of all of the people of the state of New York, but particularly on behalf of her leadership here in central Brooklyn. She could be any place in the state of New York right now, 20 million people, but saw fit to be right here in Bedford-Stuyvesant, central Brooklyn, at the Interfaith Medical Center, because she knows the stakes and she cares about all of you. She cares about all of us. So thankful for all of the participants today in this critically important hour as we fight to defend the health care of the American people. You know, the GOP tax scam is not one big, beautiful bill. It's one big, ugly bill. Yes. That will hurt everyday Americans, hurt everyday New Yorkers, and it's designed to reward their billionaire donors like Elon Musk. It would visit upon the people of New York and the American people the largest cut to health care in American history, the largest cut to Medicaid in American history. Children will be hurt, families will be hurt, seniors will be hurt, everyday New Yorkers will be hurt, people with disabilities will be hurt. This one big, ugly bill that they're trying to jam down the throats of the American people is unconscionable, it's unacceptable, it's un-American. And together we're going to do everything possible to stop it in its tracks and bury it in the ground, never to rise again. They want us to step back. We're here to make clear we're going to fight back. That's right. Now, this bill limped out of the House of Representatives by just a single vote, which means that any one of my Republican colleagues in New York could have stopped it. Right. Any one of them could have stopped it, because every single Democrat in New York, every single Democrat in the country was strongly opposed to it. And that level of opposition you're going to see in the United States Senate. And so this is just the beginning of an ongoing struggle to protect Medicaid, protect Medicare, protect the Affordable Care Act, protect the health care of the American people. Our message to the members of the United States Senate, our message to Donald Trump, to J.D. Vance, to Elon Musk, they want to take a chainsaw to Medicaid. They want to take a chainsaw to Medicare. They want to take a chainsaw to the Affordable Care Act. We're going to take a chainsaw to Project 2025, no matter how long it takes. And we can start by stopping this one big, ugly bill, because it's straight out of the Project 2025 playbook. Here in New York, in America, certainly in our communities, we don't believe that access to high-quality health care is a privilege. No, access to health care in New York, thanks to the leadership of Governor Hochul, access to health care in America is a right that should be available to every single person, which is why we're fighting hard to protect Medicaid and Medicare and the Affordable Care Act, all of which are on the chopping block at this moment in time. Now, in 2017, they tried to repeal the Affordable Care Act. And similar to what happened then in the House, the bill limped out of the House of Representatives after a few failed efforts, just like it's limping out of the House of Representatives right now, went over to the Senate, where we had an opportunity to finish it off with unified Democratic opposition and just a handful of Republicans at the time, including John McCain, who did the right thing. And so we're calling on just 4. All we need is 4 Republicans in the United States Senate. There are 53. All we need is 4 to do the right thing. And so we're going to make sure that our voices are collectively heard, led by the governor, led by Ken Rasky, led by 1199, led by this great coalition as we fight to protect the health care of New Yorkers and the health care of the American people. So I'll close with one simple message, a message that wherever I am across the country, whenever I'm on the House floor, we make clear we don't work for Donald Trump, we don't work for the extremists, we work for the American people. We work for the American people, all of you, and that means keep your hands off the health care of the American people. Keep your hands off our Medicaid, your hands off Medicare, your hands off the Affordable Care Act. Keep your hands off our health care. Hands off today, hands off tomorrow, hands off this week, hands off next week, hands off this month, hands off next month, hands off this year, hands off next year. Keep your hands off our health care forever. That's our charge, that's our mission, that's our goal, that's our objective, and we will not rest until it's accomplished.
That concludes our program. Thank you for attending. We look forward to seeing you again.
Program coming up.